So my name is Jamie Hartwell. I'm a physiotherapist. I've been graduated for almost 2 years now. And on the side, I run a small Zumba company offering weekly Zumba classes to members. So early in my high school sporting career and towards early university, I faced a lot of injuries myself, and that's part of the reason why I became a physiotherapist. Having those injuries, I went to a lot of private physios, and they helped me a lot to get through these injuries. Because of that, I started to be involved with UBC basketball as well, and because of that, I was able to work with some student physios and some professional physios as well, and that gave me the opportunity to kind of dabble more in what physio was all about. And that just kind of led me in the path that I started a couple of years ago and then ended 2 years ago, and I've been working in the same field ever since. Physiotherapy school at UBC was quite challenging. It's an exhausting 2.5 years where you have a lot of fun, but you also work very, very hard. You get very close to a group of 80 people because that's your core group of people for the next 2.5 years, and you work hard and you play hard together through that process. It was exhausting, but it was nice to have school that was applicable and you knew was going to be applicable at the end of the road. So each day when you're actually learning something, you're actually knowing that this is going to be translated into a job someday, which was nice. The toughest part of school for me was probably my first clinical placement. I was thrown right into acute care physiotherapy and at VGH, which is one of the hardest places I would say to start because it is quite fast-paced. But I got through my fears of being in that unfamiliar setting that I was not familiar with, as physio was always a private practice thing for me, whereas in this case it was quite the opposite. I was dealing with very sick people, and so the preceptor I had was amazing, and I learned so much right from the get-go and overcame a lot of fears, and so that allowed me to move forward in all the other things that I did with physio. The best part of going to school was actually learning applicable things and actually being able to translate that into placements. And it was nice that placements for us were spread out throughout the program. So every time you kind of learned something, you could turn around and use it in clinical practice. And so that was actually nice to be able to turn a book and what you read in a piece of paper into treating a patient and seeing that be effective instead of just reading it on a piece of paper and not being able to really understand why this was relevant or helpful to somebody. I think it's a field that's very well respected as well as very high in demand. So having the ability to go into a job that you know you're going to love and that you are going to have opportunities in is hard to find nowadays. A lot of people struggle when they come out of school to find careers and to find jobs in their related field, and physio is not one where that will be the case. So if it is something you truly love and are passionate about, work hard to get there, because in the end, you will have a job that you love. Physio also does offer the ability to do different types of jobs. You can work in neuro, you can work in private, you can work in acute care, you can work with elderly, children. So many different opportunities that if you ever were to get bored or stressed or something in one field, then you could translate that to another without having to redo school or anything like that. It's not very different than I think any other job. You finish school. When you're done school, you start looking for a job. You start to do interviews. Interviewing at multiple places is not a bad option, just to see what's out there. I did a bunch of clinic tours as well, not necessarily interviews, but clinic tours, just to kind of see what different clinics have to offer and what I was looking for in a clinic. So I think don't be afraid to really have yourself a checklist of what you would like for a clinic, because I think when you're starting out, you want to commit to something for at least a year, I would say, to make yourself comfortable and to build a reputation for yourself, especially in private practice. So exploring options with, different public versus private, and then different clinics as well in the private sector would be the best way to kind of start that process. And then once you get comfortable, once you get working, you just kind of let things roll, and then hopefully you're happy in the place you ended up because you made a decent checklist and satisfied those checklist items, and you're comfortable for at least a year, and then from there, keep going. I think the hardest part with starting is building a caseload, because you have absolutely no reputation. No one knows you out there as a physiotherapist, so building a caseload is the hardest part. It probably took me a good 6 months to actually build a caseload where I was making money, probably the equivalent to another job. And so you have to be patient. You have to understand that it takes time for your people to appreciate what you do and to send family members, friends to you, for the clinic to really understand what your skills are all about. And having those skills, people are able to refer people to you, as well as the clinic is able to book people for you because they saw you do such a good job with this particular injury. So definitely being patient with that. It's not easy in the beginning when you're only seeing 2 patients in a 4-hour day, or 8 patients in a 12-hour day, and you're kind of sitting there thinking, where are all the patients? And it just takes time to build. I would say getting out into the community, or doing things. For me, it was Zumba. So a lot of the time working with people in the community, or advertising myself as a physiotherapist. When I was in social situations, people would be, oh, you're a physiotherapist. Great. I have this problem. Where do you work? Can I come see you there? And so necessarily putting these into conversation sometimes were helpful. Or in my Zumba classes, someone would have an injury and you don't hesitate to give them a card, because that card might lead to them coming to your clinic, or potentially a friend of theirs coming to the clinic as well, just once your name is known out there. Not being afraid to promote what you do and why that would be helpful to somebody, because a lot of people aren't aware of the fact that physiotherapists do a certain thing. They're not aware of how physio can help them. And so just educating people that you meet in the community about physiotherapy is helpful for them and yourself in building a caseload. The best part about private practice, in my clinic especially, is working with a team environment. I know in public practice it's supposed to be a team as well, and it is very much so, but in public, the doctors are taking care of medical concerns, you're taking care of physical, and there isn't really an overlap in that, where in private practice you actually get to work with everyone working towards a physical therapeutic goal. So I find that to be very, very wonderful, and having that ability to be able to work with the expertise from different specialties and being able to work towards the common goal and what's the most effective way to treat this patient. A piece of advice I'd give to physio students that are just looking at getting into the workforce is to not be afraid to accept all avenues. Yes, there are a lot of jobs in the field right now, but finding something that you want is going to be something that might not necessarily come the first time around. I was very lucky in that I got a job that I was very happy with, but a lot of people in my graduating class have left various positions and tried other things. So I think just being open to what's out there and trying different things potentially to find what works for you, because not every clinic or public practice position is exactly what you're going to want, but sometimes you have to start somewhere to get the experience. So I think just being open to that and starting somewhere and getting your foot in the door is going to be something that you might have to do if your dream job doesn't come around the next day. When it comes to extra courses, I did a handful of courses before I graduated. I did some soft tissue work, and I did the Mulligan course prior to graduating, which I found very helpful because I was able to use them in private practice placements before even graduating. Other courses that I did afterwards I found useful, but I would be careful in taking too many because you're still solidifying the skills that you have from school. I personally took acupuncture, and I found that to be really helpful, and that's one that I would consider doing even when I was still in school. It's a lot of work, but it's definitely well worth having the extra skill, especially in Vancouver when a lot of people do ask for acupuncture. They're aware of that it exists, they're aware of the benefits of it, they're aware of the fact that other people have tried it and found it helpful. So that would probably be one that I would say you don't learn anything about in school. And so that would be one skill that people might ask you about, or other clinicians might have, that you could set yourself at least on the same level as these other clinicians, or at least be able to offer the one extra tool in your toolbox other than modalities and manual therapy and soft tissue and all this other stuff. I have not taken any manual therapy courses beyond my physio school yet, because I found basic skills currently are just as effective in my practice right now, and I'm still honing those basic skills. And once I learn those basic skills well, I would like to, do the next step when it comes to manual therapy or sports or whatever field. But acupuncture is a different skill completely, and needling is not taught at all. So I have a very basic understanding of needling currently, and someday in the future I hope to take additional courses in needling. I think the single biggest thing that's helped me so far has just been the fact that I've been given the opportunities to be able to practice prior to finishing physio school, and having mentors that allowed me to do that. So having physiotherapists, having coaches, having volunteer opportunities that allowed me to actually do more before actually physically becoming a physiotherapist was a huge asset to me. Every interview I went to, my resume had things on there that not the average graduate had, and had more probably than entry-level skills because of these experiences that I was given. At UBC allowed me to have extra supervision. I was able to kind of dabble in things and actually put things into practice and work with athletes that I could actually see if these things were beneficial for them, instead of waiting till I was done school and actually putting those things to practice. So having people allow me to come in to work with them, having the athletes allow me to work with them, having the physiotherapists allow me to hang around their clinic for hours on end was definitely the single most thing that was the most beneficial to me, for sure, moving forward. Because building that confidence, when you first leave school, you have no confidence in what you're capable of, but you realize very quickly that you actually have the skills to do very basic things and fix very basic people. My very first patient, looking back, sent me this email and sent the clinic an email about how, thankful he was that he had met me, and he, has in the future referred friends, family, and he will never know that he was my first patient. But he came in with painful neck, woke up that morning, and I was able to get him out the door, getting back to work. And that was my very first patient. And so realizing that you actually do have the skills, and because of the experiences I had, I should have been a little bit more aware of the fact that I had the skills, but it still took actually building confidence over time to really understand all those experiences actually led you to be a better clinician, at least initially.